mention of the word abortion in itself is automatically divisive in many countries and more so in Kenya. It puts on different sides of the divides people who defend a woman's right to end a pregnancy and those who think the rights of the unborn child come first.
My name is Jedida Maina. I'm the Executive Director of Trust for Indigenous Culture and Health, an organization based here in Nairobi that works nationally on issues of sexual and reproductive health and rights.
Jedida is of the opinion that we do not have enough information shared around with women and girls, men and boys on sexual and reproductive health. Abortion is the termination of pregnancy before the fetus can survive outside the mother's womb. This can either be spontaneous due to medical reasons or induced.
Like, for example, we've seen certain groups really opposing the comprehensive sexuality education, the education for young people about their bodies and how they can protect themselves from.
In a Ministry of Health, APHRC and IPA's report in 2018 on the costs of treating complications of unsafe abortion in public health facilities, one would spend an average of about 5,000 Kenya shillings. This would range from 3,000 shillings for mild complications, 4,000 for moderate complications, to almost 10,000 shillings in severe complications. This is in addition to the man-hours by nurses and doctors, which range from 5.5 hours in mild complications, 7 hours in moderate complications, to 12.5 hours in severe cases.
As a society, we are yet to decide that women's lives are worth saving. We have seen the numbers of unsafe abortions. The Ministry of Health and APHRC did a study back in 2012 that showed the number of abortions each year amounting to 465,000 per year. We saw the number of those what percentage of that ends up in hospitals and facilities as unsafe abortion, and we still do not see any action done. So I think as a society, even when we say we are pro-life, we have not decided that the life of the woman and the girl is still a life worth saving.
The complications from unsafe abortions include severe bleeding that is life-threatening and fatal at times, fever, pelvic abscesses and sepsis from infections introduced into the uterus, and cervical and vaginal tears from instruments used to procure these abortions. Others are shock and organ failure. Unsafe abortion remains the leading cause of maternal mortality and morbidity in Kenya. A 2012 national study by APHRC, the Ministry of Health, IPAS and Guttmacher Institute revealed that almost 500,000 induced abortions happened in 2012. Of this, only 157,000 women received care for the complications in health facilities.
We're asking the Ministry of Health to implement the post-abortion care guidelines that they have just recently developed, and these are supposed to be in place right now. In one of the stories earlier I heard from the girls is that when she was having an unsafe abortion, when she was looking for emergency treatment, because that is emergency treatment, post-abortion care is and should be considered as emergency treatment. And when she was looking for this service, even when this service is supposed to be readily available in all government facilities, she did not know this, and she was being charged 10,000 shillings. We do know that 10,000 shillings is way beyond anyone's budget, especially for women and girls in communities in need, and it is just discriminatory if a certain percentage of our community cannot access a service that the government itself says it is providing in health facilities. So it's such a shame that a woman would need to raise 10,000 shillings for a service that we do know should be treated as an emergency treatment within our laws.
Women who sought post-abortion services were from all walks of life, not on any contraception prior to getting pregnant. Educated and uneducated women, urban and rural women, Christians, Muslims, and women of other faiths alike, employed and unemployed, married, never married, and divorced women too. 23% had mild complications, 40% had moderately severe complications, and 37% had severe complications. Severe complications were mainly noted in 10 to 19-year-old girls and divorced women.
We have seen the reproductive health bill right now being reduced to one article, just the safe abortion article, while it provides for a lot of other services that women and girls need. So we would like to see healthcare providers within this country speak up about what these laws mean, what these policies mean, and what kind of services they should be able to provide. We would like to see healthcare providers also provide friendly, non-judgmental services. From one of the stories I did hear a girl say how badly she was treated when she went to access the service. When places where women and girls should access the service treat them badly, what are we saying?
We met with two young girls, one who had an abortion at 19 years and the other at 22 years. Both of these girls count themselves lucky to have survived the near-death experience. We shall call the First Lady Jane Doe. She had just started college when she got an unplanned pregnancy. When her partner at the time abandoned her, she sought to terminate the pregnancy.
The experience happened when I was 19, like a week to my birthday. So, nilikuwa tu na feel kutapika, nausea, zile tu signs za pregnancy. Nilikuwa nimekuwa mpale, mweupe, ile excess kabisa. Then nimeanza kupungua, then mimi ni mtu wa mwili, as you can see niko na mwili. So, mamangu siku tu moja nimelala, mamangu akakuja kunimulika kwa uso. Akaniambia, umekuwa mweupe sana. This is just not your color, and hiyo upe yako, it's not good at all. Fanya aje, it was on Sunday. Fanya aje, twende tupime. So mi sinimeogopa. Nitakaa kweli. So I ran away from home. Went to a friend's place. Getting there, my friend tells me to pime. We go buy a pregnancy kit, yeah, 50 bob. We go at their place, I test. It comes out positive. Sinika text baba mtoto. Kaniambia umeshapima, nikamwambia nimepima. Imekuja positive. Sawa. So hana shida, hakuwa na shida. At first hakuwa na shida. Nikajua at least niko na backup. If anything happens at home or anything goes wrong, I'm not ready to be a mom, but I can. That was the first day I told him. The second day, na text, sijibiwi. Na call, simu hazishiki. Unajua sasa nimeanza kuwa frustrated, nimeanza kupanic. Napatana na beshte yake kwa barabara nikienda kwake. Ati unajua hayuko home, alitoka jana na sijui atarudi lini. And I'm like, when he traveled, ati he's not around, he went to his brother's place. Beshte yangu from there kaniambia, we tujua you're on your own juu hapa hivi tu ndio kunaendanga. Mimi nikampatia benefit of doubt, ikafika jioni. Akasema acha nicall tena. Acha nicall na number different. Simu haishiki. Kidogo ako mteja. So, sijui nitafanya aje, niko kwa beshte yangu, siwezi rudi home. Beshte yangu akaniambia, najua msee. Hata si eti anajua msee, it was a friend of a friend. Tumuulize, tutafanya aje. There is someone I know mwenye anaweza kupatia dawa tutoe. Jununa sahi, it's not something imefika 1 month, tunaweza toa. Juu sahi, enyewe uwezi eka mtoto. I didn't have money. We didn't have money. We don't know the woman. Tukaambiwa tuende place side za Kawangware. So we go there. Tukaenda kwa mama, akatupatia dawa. Dawa ilikuwa kwa chupa ya Fanta, hii ya 70 bob. Imejazwa, but ni mitini dawa, it's a mixture, it's like a concoction. Kaniambia, hii ukienda home, ukunywe usiku ukienda kulala. Within hiyo usiku, things will happen. Ukiamka asubuhi ama hiyo usiku, within the night, itakuwa tu imetoka. So don't worry. It was cheap, very cheap. It was 1,500 shillings, but we bargained. Akaniambia thao iko sawa, jueni mdogo, thao iko sawa. Nitakupea. So si nikamwambia thao yeye akanipatia dawa. Nikaenda home. Usiku ikafika kwenda kulala, nikasema I had not even eaten. Sikuwa nimekula for those 3 consecutive days. Maji peke yake nilikuwa stressed. Nikakunywa dawa yote kali. Miti ni dawa, like ni miti ni dawa yenyewe. Nikakunywa. Si mimi nilale ningoje. The whole night massive cramping. Kiuno inaniuma, inakaa nika inakatika. Tumbo inaniuma, nasikia vibaya, but nothing is happening. Hakuna kitu inatoka. Naumwa tu na tumbo na kiuno. Ile mbaya, ile nyesi. I was actually crying. Beshte yangu amenishikilia kwa room yake. Tumefunga mlango, wazazi wake wasisikie. Ikakaa. Hakuna kitu inafanyika. I woke up hiyo siku 6 a.m. in the morning. Nilieka tu mguu hivi chini before hata ni move. Damu mob. Damu mingi. Sijaona damu mingi kwa maisha yangu hivyo. Sasa hapo nimesha panic. Nashindwa what will I do? Sikuwa na pesa, kitu ya kwanza. Siko home, siwezi sema home. Beshte yangu wezienda atiambie mama yake kitu imefanyika juu atasema. So we have to shut up and just deal with it. Daktari akaniambia, this may lead to a lot of things. Juu unaweza kuwa na internal bleeding, hata maybe time utataka mtoto, you may have issues. You have to be cleaned. Lazima uende uone mtu mwenye hata mimi siwezi kuhudumia. Tuliambiwa tunafaa kukuwa na like 10k. 10,000. Tunatoa wapi 10,000? Beshte yangu akaniambia, mimi am very willing nishikishe simu yangu, ushikishe simu yako, tupate do. At least utibiwe, then tutajua what next. Si beshte yangu ni atoke hosi, ameniacha hosi sasa. Aende ashikishe simu, alete do. Daktari atusaidie. Daktari ananiambia the best. So beshte yangu si ameenda, ananiambia unajua beshte yako, she's just as young as you. You people don't know what you're getting yourself into. Hii ni kitu kubwa, si ndogo. You should call someone mwenye ni mkubwa. Mimi nikamexplainia, nikamwambia home, mimi siwezi ambia mamangu. Mama yangu siwezi mwambia. Mamangu ni no go zone, siwezi tu mwambia. Kaniambia, then I don't know how I'll help you, but nitakusaidia tu, acha akuje. Beshte yangu came back with 8,000 shillings. Kasema nimepata tu 8,000. So what next? Daktari akaniambia, I know a friend of mine, a doctor friend of mine. You'll go to their hospital, useme ni mimi nimekutuma. Nishamu-explainia situation. But beshte yangu akasema ni sawa, mimi nitakupeleka. 5 tukaenda West, tumefika hivi tumekaa. Kufika huko, I don't know, there was just something off. Wase wanatuangalia ile nye, kwani what's happening? Sikukuwa na nguvu, nimeisha, nakaa tu wenyewe, siko sawa. Sio daktari akakuja. Kukam, akatuingiza kwa hiyo room. Venye daktari anani-treat, si venye unaweza treat mgonjwa. Okay, mimi nilifeel ilikam to me hivyo. Like, as much as nimefanya kitu mbaya, as much as nimefanya makosa, you don't get to like talk to me. Ananiambia panua mguu, like ananishautia tu. Beshte yangu akaniambia, we vumilia, tulia tu. Just do whatever he wants you to do. You know wewe ndio unamhitaji, ya kuhitaji sahi. So just work with him. Nikapelekwa kwa room fulani, beshte yangu akaambiwa baki nje. Akatoa tools, vitu mingi. All of them ni chuma. Sasa nikiimagine hizo chuma. No. Sasa nikiimagine situation yangu niko zile za ni sawa. Akaniambia panua mguu, tukafanya procedure. Ikaisha.
The second lady, who we shall call June Doe, already had a son. And according to her, much as she would have wanted to keep the baby, her financial status at the time of this unplanned second pregnancy would not allow her to continue with the pregnancy.
2 months later, I developed some complications. I suffered from an infection, urinary tract infection. I also had a throat infection at the same time. So it became difficult for me to handle my pregnancy, and I'm still a mother. At that time, my baby was 3 years. So, and the one responsible for the child bailed out on me. So it became very difficult for me to handle my pregnancy and this other child. So 2 months in my pregnancy, I decided to terminate it. I kept it a secret all this time, but people were suspecting because I got really sick to the point I couldn't get off the bed. So I talked to my hairdresser, and she's the one who advised me to terminate it. So she took me to this local chemist around my hood. I paid 3,000 shillings, and I was not given options on how I was going to go through this process. I was just given pills. I was inserted 2 pills, and then given 2 other pills to put under my tongue, plus other different pills to swallow. It was around 5 in the evening, and by 7 p.m. I started bleeding. By 10, I was shivering and in a lot of pain, cramping, and the bleeding became intense. So I was given some painkillers. I took them, and I didn't know how I slept. I just slept. And it was a shock for me in the morning when I woke up and found myself in a pool of blood. Like, my bed was just blood. I woke up and I was trying to change my sanitary towel. Something fell off, and that's when I realized it was the baby. Initially I was okay, but the bleeding was terrible. It was terrible. It couldn't handle the sanitary towel.
It's very funny that men mostly, even the people who make the laws are mostly men, and they make the laws for body parts that they do not have. And very rarely are we having like really good community participation about women and girls and on their lives and what that means for their lives. The other thing that we also see is that there is very little responsibility held on men when cases of unwanted pregnancies happen. From the girl stories that I heard earlier, most of the time you will hear that when a pregnancy happens, the man is allowed by society and by everyone else around them to just refuse to take responsibility. And responsibility in this way is always left for the woman, but then the woman is never let to have a decision or a say on what services that they need at that time or what the laws need to look like at that time.
I would love to tell young people, please be responsible for your own lives. No one is there to take care of you. These young people are exposed. They know that there's teenage pregnancies, they know there's contraceptives, they know that there's HIV, they know that there's STIs, they know everything. But some of them are just being ignorant. They're not taking precautions, they're not taking care of themselves. So I'd like to urge young people, please be responsible for your own lives. Take care of yourselves. Don't wait for someone else to come and to clean up your mess. Don't mess up your lives. Just be responsible and take care of yourself.
I completely think that we need to end stigma on even just the word abortion. I think the word abortion has been mystified, and we need to demystify what abortion is. For example, we do know that miscarriage is called spontaneous abortion. Abortion that happens by itself, it's not induced by anyone. And do you know when women do need services for miscarriage, it's the exact same service that women are given if they are having an abortion or have had a botched abortion. So when we lock out all services that concern abortion, it means that we are locking out even that woman who will be having a spontaneous abortion, which is a miscarriage, which is a very common occurrence for women and girls.
Dr. Masi Korir for Health.